Hi, I am Dr. Dominique Bain, and today I'll be sharing some info with you on your pet's eyes and ears. Let's start with the windows to the soul, shall we? This saying also rings true for your pets. Their eyes can tell if they are happy, sad, nervous, and even under the weather. The eyes can also be stricken by serious conditions, which we will discuss further. As with many species, the eye is what allows an individual to see. It does so when light enters the eye and is focused on the light-sensitive area at the back of the eye, where it is converted to electrical signals that can be transmitted to the brain. As we can tell, the eye is very intricate in structure and function. This is why it is so important to pay close attention to any abnormalities detected, because anything that affects this pathway can affect vision. So let's talk about what is normal. A normal, healthy eye should be clear, bright, and free from dirt, discharges, and redness. There should be a white portion surrounding the round, colored parts of the eye. The colored portion may be brown, gray, blue, and one eye may even be a different color than the other. Now, it is important to note that some discharges from the eyes are normal. Little bits of clear to pale colored discharge in the corner of your pet's eyes, particularly when waking up, is not typically a cause for concern. You may not even notice it as it may be cleared away easily or it may become dry and crusty over time. Come on, let's face it, we too have all been there. Sometimes, especially on dogs with light colored fur, as it is most easily seen, you may observe ongoing reddish brown areas on the face from the eyes. This is commonly referred to as tear staining. Tear staining may indicate that something is going on, such as stress, food allergies, or blocked tear ducts. But oftentimes, the discharges mentioned thus far are simply a mixture of tears, oils, mucus, dead cells, and dust particles. What is necessary is that you pay close attention to discharges and if they have suddenly changed, particularly in color, consistency, and amount. Any discharge previously determined as normal, which changes in such ways, warrants further investigation. On the contrary, there are some discharges that need immediate intervention. Yellow-green, grayish discharges thick and in copious amounts, and those that are different from what you regularly notice from your pet's eyes should be checked out by the vet. These discharges may indicate eye infections, such as feline herpes virus in cats or bacterial eye infections. Conditions like dry eye can also present in this way. When left untreated, serious complications may result. Swellings may be an obvious sign of eye issues. Swellings of the eyelids or the conjunctiva, which is the membrane that covers part of the front surface of the eye and the inner eyelids, are commonly seen with allergies and insect stings or bites. Cherry eyes are another common type of swelling of the eyes, which is actually the prolapse of the third eyelid gland, a structure of the eye that is not typically visible. It may affect one or both eyes and may vary in size. It is usually seen in young dogs and is most times something your pet's breed is genetically predisposed to getting. Your dog may not seem to be bothered by it, but in the event of self-trauma, it can be dangerous. So there's a surgical procedure which tacks the gland back in place. Another issue is sudden or gradual change in the size of the eyeball itself. This is a cause for concern. This can happen in one or both eyes due to a number of causes. Sometimes the eyeball may protrude suddenly from the eye socket after a traumatic injury, or a gradual increase in size or protrusion as in the event of tumors growing behind the eye, or even conditions such as glaucoma, which is an increase in the internal fluid pressure of the eye. As mentioned previously, there are deformities that your pet may be born with. Two common ones involve the eyelids and the eyelashes. Sometimes the eyelids may roll inward on themselves. And with regards to the eyelashes, they can sometimes grow in the wrong place or direction. Either of these abnormalities can lead to irritation and damage to the eye surface. Surgery is usually required to avoid further complications. Similar to humans, your pet may suffer from conditions which we too are familiar with. Corneal ulcers are erosions of the eye's corneal layers due to scratches, trauma, or irritation. This defect can spread deeper and may even become infected. The usual smooth surface of the eye will appear irregular, and the affected area oftentimes appears cloudy. Left untreated, deep corneal ulcers may cause irreversible damage. Another eye issue that can cause cloudiness is cataracts. Cataracts are opacities in the eye's lens. In the early stages, your pet may be able to see around the cataract, but the cloudiness usually worsens slowly and increases in size, ultimately affecting their ability to see. Cataracts can be caused by conditions such as diabetes or may be inherited and develop with age. Note, however, that there are other age-related changes that can present as cloudiness to the eye but do not affect vision. Your vet will help you to distinguish. Another common eye condition with senior patients that may cause cloudiness is glaucoma. Glaucoma is a group of conditions which results when the internal pressure of the eye is increased. This leads to damage to the major nerve behind the eye, which can lead to blindness. Even though it is associated with older age, some breeds may experience this even in their more youthful stages. So take a look into your pet's eyes. What do you see? Besides love and admiration and that look they give you when they want a treat, do you see anything unusual? To rehash, a general list of eye abnormalities that should raise some concern include any swellings, enlargements, or protrusions, discharges that are yellow-green, grayish, thick, copious, crusty, or unusual, cloudy eyes, redness, pawing at the eyes, rubbing the eyes on the walls or the floor, and irregular surface of the eyes. If you notice any of these signs, give us a call and we will guide you accordingly. We may ask you to share some pics with us. We may recommend that you flush the eye that is affected with some water or use a clean, damp, soft cloth or cotton soaked in lukewarm water, pulling down the lower lid and very gently removing discharge that has accumulated. We may even suggest that you start an over-the-counter antibiotic eye drop. But on many occasions, we may suggest that you come in based on what you explain and share with us, especially if your pet is experiencing discomfort and there is risk of self-trauma to the eye. When you come in with your pet for an eye checkup, your vet may also ask you questions about your pet's overall health, as systemic diseases may also present with ocular signs. Your vet will examine your pet and their eyes. This will include looking at what can be seen with our naked eye, as well as using an instrument called an ophthalmoscope, which allows us to look at everything from the surface of the eye to the back of the eye, including nerves and blood vessels. Your vet will then decide which tests, if any, will help with the diagnosis. These may include testing for visual responses and reflexes using the ophthalmoscope, objects, or even simple obstacle courses. Your vet may check your pet's tear production levels, use a stain on the eyes, or an instrument to measure eye pressure. After examination and tests, a treatment plan will be discussed. We want to work along with you to keep your pet's eyes healthy. So if you have any concerns, we will be more than welcome to guide you and have your pet in for a checkup. That was indeed a lot. I guess we can say the eyes have it. Now that you've heard and received all that information, it's time to move on to ears. The ear is the organ used for hearing. It consists of three main parts: the outer ear, the middle ear, and the inner ear. The outer ear is what consists of the pinna or ear flap, which we can see, and the ear canal, which we can only really see the opening to. The different parts of the ear function as a system, working together to turn sound waves into vibrations and then nerve signals, which can be transmitted to the brain. The ear is also important in maintaining balance in mammals. The ear, like the eye, is intricate, and if one part of the system is affected, it's possible that the function of the others may be compromised. A normal ear should be covered in fur on the outer ear flap and free from lumps, bruises, scabs, etc. and the inner air flap should also be smooth with a pale pink color. The air should not smell, and if a mild odor is detected, it should only smell waxy. The air may also feel waxy, but it shouldn't be moist. There may be small amounts of wax in the air, and it may vary in color from golden yellow to brown to black, depending. Right at the start of the air canal, a few tiny hairs may be visible. There should be no protrusions from the air canal. An abnormal air can present in many different ways. You may feel lesions on the air flaps. The inner air flap may appear red and sometimes may even swell very large. Scratch marks may be visible on and near the air. The air may have a foul smell and may have unusual discharges such as pus, blood, or copious amounts of thick wax. You may see your pet scratching and pawing at the area excessively. They often shake their heads vigorously or have a head tilt. Some animals may even begin to walk in circles or may stop responding to your call or noises. What is important is to achieve a baseline of your pet's normal so that changes to abnormal will more easily be identifiable. We will now talk about some common problems that can affect the ear, one being ear infections. Ear infections are caused most often by bacteria or fungi or yeast. You may first notice that your pet seems to be experiencing some discomfort by shaking or tilting their head and scratching the ear. This may progress to visible discharge, which can become so plentiful that the fur around your pet's ear may become moist and matted. Also, and one of the biggest indications of ear infection is the smell. You may experience an unpleasant odor from your pet's ear, unusual to their normal. Some things that predispose your pet to ear infections are water in the ear canal, which can happen especially after baths and with swimmers, as it is hard for them to shake water out due to the L shape of their ear canals. Also, excessive hair, which traps moisture and dirt. Microorganisms tend to thrive in these moist, dark areas. Any dog can be a victim, but some breeds are just more prone to ear infections than others, especially dogs with those big, beautiful, floppy ear flaps. It's important to act quickly on ear infections because they can be difficult to treat. It may start off as mild irritation with few signs of discomfort, as mentioned before, and gradually progress to the point of severe inflammation, even occluding the ear canals. This can become very painful and can be so damaging that special types of surgery may be required. Your vet will examine the ear and may need to take samples before prescribing medication, which could either be topical in the ear or oral. Mites are a parasite. You may have heard of them affecting the skin, but some mites are specific to the ear and can cause your pet a lot of distress. They will present with signs of discomfort as mentioned previously, and often with dark brown discharge. It is important to control mites because they can be passed from one animal to the next. If your vet suspects mites, they would usually take a sample from the ear to be viewed under the microscope to try to detect the mites and then discuss treatment with you. Another common ear issue is the swelling of the ear flap. This is what your vet will usually refer to as an oral hematoma. It is caused by trauma causing rupture to the vessels of the ear flap, leading it to fill up with blood. The trauma may be anything from a road traffic accident to excessive scratching as a result of an ear infection or mites. Whatever the cause, the most aesthetic fix is by surgical repair. This is best done in the early stages before scar tissue begins to form, causing the ear flap to crinkle. Also, if left untreated in any way, your pet may rupture the swelling, which has potential to become infected. The last ear problem we'll discuss are tumors of the ear. These may affect anywhere from the skin of the ear flap to the ear canal. Similar signs are seen as with other conditions. Tumors on the ear flap are visible, but that doesn't always mean that they are easy to surgically remove. Some masses may just involve the skin, but others may be more invasive and involve cartilage. And then, most invasive of all, some ear masses may be growing within the ear canal. These masses can even result in deafness, and be more difficult to remove. Air masses can be quite scary, so it is important to pay close attention to your pets, especially if they are showing signs but nothing is visible to you. It may be something your vet has to look deeper to see. So, all in all, at home monitoring of your pet's ear is crucial. This will allow you to have a baseline. You will be able to detect if there's an excess of dirt and wax or if there's a slight change in smell. These may call for a quick ear cleaning. In pets with frequent ear infections, you may be able to curb a yearly occurrence by getting a head start on maintaining clean, healthy ears. For ear cleaning, a commercial cleaner is preferred over an at-home concoction as they are specifically formulated for this purpose and generally safer. Start by holding your pet's ear flap upright and gently filling the ear canal with the solution. Carefully massage the base of the ear for about 30 seconds. You will hear a squishing sound as you irrigate the solution, allowing it to break up dirt and wax. When finished, gently wipe the ear from inside to out to remove buildup. The frequency of this process will vary from animal to animal, but it should not be done in excess as it can lead to irritation. Your vet will advise you based on your discussions and examination of your pet. Another at-home tip is to avoid water getting trapped in the ear canals. When bathing your dog, cotton can be placed to soak up excess water. Water should be run with a gentle flow in a downward direction only on the outer ear flap, or a washcloth can be used instead. If water in the ear canal is unavoidable, such as with swimmers, ensure that you dry the ear afterwards with a dry cloth or tissue. After ear cleaning, baths, and swimming, allow your pet to shake the excess water out as they most often do. Finally, if you notice signs of something, contact your vet before attempting anything yourself. We will be happy to guide you accordingly. When you bring your pet to have their ears checked, your vet will ask you some questions and then proceed to examine. An instrument called an autoscope is often used to look deep into the ear. It may be necessary to take samples from the ear before implementing a treatment plan. Here at Animal Medical Center, we value your pet's overall health and well-being. We aim to work with you to ensure the best possible care of your furry family members at home and at the clinic. If you have any questions or concerns, we welcome your calls. Thank you so much for listening in today. It was a pleasure to share this info with you, and we hope to have you back for the remaining client education.